Hello, everyone. My name is Dr. Ashok Agarwal, and I will be your host for the next 2.5 hours. And we are here to welcome you to the next online ART training in Module 5A, which is Overview of IVF and ICSI. Today is Tuesday, May 18, 2021, and this program is made possible by the American Center for Reproductive Medicine at Cleveland Clinic. Again, welcome to everyone. So here we go. This is my short biography. Um, for those who have not attended the previous program, I'm the Director of Andrology at Cleveland Clinic within the Department of Urology. I'm also the Director of Research and very much involved in research in the causes of male infertility. So our program is one of the most active programs looking at the research, focusing our research on causes of male infertility, looking at how we can find solutions that can benefit patients who have male factor infertility. The organizers and the speakers have no conflict of interest. No companies or outside entities were contacted for sponsorship of these events. This program was made entirely possible by the educational support by the American Center for Reproductive Medicine, and the webcasting was supported by David Reichling, David Wolfley from our Information Technology Division at Cleveland Clinic. Thank you to them. The course faculty who you will be hearing today have donated their time for this online training course. Program coordinators you will meet here have volunteered their time for this training. The names, images, and description of products and instruments that you may see in the lectures are used routinely in various laboratories, IVF labs, and these items are not endorsed by the speakers. So today's program, as you have seen, this is called Module 5A, which is basically an overview of in vitro fertilization and intracytoplasmic sperm injection. The program is supposed to complete by noon because it includes the part related to multiple choice. Our lecture component should finish within 2 hours. We have timed it. So the learning objectives today is talks related to essential equipment, supplies, and culture media, protocols for oocyte retrieval, oocyte denudation, and embryo transfer, oocyte characteristics and embryo quality assessment, and important parameters for embryo culture, monitoring, and quality control. In addition, we have two more lectures, one by Professor Hassan Salam and one by Kelly Athayde Wirka. So these are the components of the today's program that you will see starting from in a circle, starting from equipment to oocyte retrieval, gamete quality, embryo culture, expert commentary, and then industry perspective, and a very brief conclusion.
My name is Kelly Wirka. I'm a medical director with EMD Serrano for the groups of fertility, endocrinology, medical affairs in the United States. Today, I have the pleasure to present about the industry perspective, assisted reproductive technologies, and key performance indicators. Earlier today, you had the opportunity to learn more about gamete quality and embryo selection strategies, oocyte retrieval, denudation, and embryo loading for transfer, embryo culture requirements, essential equipment supplies, and culture media. You also had the opportunity to learn more about the clinical perspective. And my colleagues, Dr. Israel, Dr. Christina, and Professor Hassan, were the presenters for those outstanding sessions. So with that, let's dive into key performance indicators and learn a little bit more about how we can actually monitor and track the improvement of the IVF lab. So let's begin by talking about the progress of assisted reproductive technologies, ART. ART is defined as all treatments that include the handling of gametes and embryos. And if you think about traditionally when IVF was at its inception, the treatments were quite different than what they look like today. So for instance, traditional IVF would be usually a controlled ovarian stimulation, followed by an oocyte retrieval, and then oocyte insemination, then probably growing the embryos to cleavage stage, perhaps day 2, day 3, and then a fresh transfer. Nowadays, most of us are doing blastocyst transfers, but we are also doing frozen embryo transfers, and there's also pre-implantation genetic testing, right? So when we look at the two, traditionally and the contemporary ART, things have changed. Alternative add-ons have been added to the cycles as an attempt to maximize chances of treatment success. Additionally, when you look at the growth of IVF around the world, we can see that it has been increasing year over year. For the United States, when we look at the SART registry data from 2014 to 2019, we see a growth of 9.2% per year. And also, if you think about lab technologies, they have been rapidly developing, and there are frequently a variety of procedures and different methods available for the lab. Also, the high demand for ART and the technical progress we have been making in terms of new technologies, hardware, and software. So this leads us to performance indicators. What are performance indicators? A performance indicator is a metric which informs about some elements of performance. As you can see here, performance indicators are objective measures for evaluating critical healthcare domains. So it could be related to patient safety, effectiveness, equity, patient-centeredness, and so on. But then we also have key performance indicators, and usually you can choose which ones will be your key performance indicators in your IVF lab. But what are KPIs? KPIs are deemed essential for evaluating the introduction of a technique or a process in your organization. So if we apply that to the clinical laboratory setting, you can see here described in this purple blue box. In the setting of a clinical laboratory, quality indicators are necessary for systematically monitoring and evaluating the laboratory's contribution to patient care. So this is really part of what we call a quality management system, QMS. So why are KPIs important? As we discussed, quality indicators are necessary and part of the quality management system for your lab. It helps us to evaluate the introduction of new processes and technologies, procedures. It helps us to monitor ongoing performance. It helps us to benchmarking, to define minimum standards for proficiency, competency levels, and quality improvement. When we talk about benchmarking, for example, benchmark is the continuous process of measuring performance. So you could be using benchmarking to either establish a minimum standard for your lab and or to actually establish an aspirational goal. For example, you would use benchmarking to compare your rates to industry standards, but also to see how well your lab is doing overall. Here are some essential features of KPIs. So reliable, robust, routine, it has to be done in a routinely way. Specify the data to be collected. So how and how many data points you will be selecting and analyzing to actually measure your KPI. How to derive the KPI from the data you collected, and then how often. Of course, if you're talking about a bigger lab, you probably are doing this on a monthly basis. But if you're talking about a smaller lab, perhaps you will establish a certain number of cases for you to be able to be calculating your KPIs. Important to realize that there are factors that will influence the IVF procedure success, right? And we know that, and we can't really control those aspects. So, for example, patient factors regarding their medical history, treatment factors regarding the clinical protocol for ovarian stimulation, for example, and the clinical practice, the decision to proceed with that treatment for that patient. Also biological factors intrinsic to the patient, so quality, and that will impact the quality and the quantity of the gametes that you are receiving in the lab. Here's an example of KPI, and this is for ICSI fertilization rate. As you can see, you would be plotting your data on a monthly basis. For example, you would have your warning limit, your control limit. Your warning limit is when it reaches a point where you say, okay, something is going on. We have to find out, right? Evaluate. Control limit is that it should not pass, it should not go below this control limit. And you can see here on the left that we have a percentage for benchmark and a percentage for competency. So competency would be the minimum rate required to ensure that you are capable of doing that technique, that procedure effectively in your lab, and it can be offered to patients, right? So as you can see at the bottom, the competency and the benchmark, there is a range between both, and you actually define where you want to be with your lab. So you might be asking yourself, so what IVF lab KPI should I be selecting for my lab? So it's important to know that there are actually no established performance indicators for assisted reproductive technology laboratories. However, and there is actually not a lot published, but there are some key publications, and I'll discuss that with you in a little bit. But there is this Vienna consensus. This is a great publication based on expert opinion, where they actually selected a list of 3 types of indicators we will describe in the next slide, and they actually recommend values for each KPI, including minimal competency limit and an aspirational goal benchmark. What is very interesting about this publication, there is a recommendation that each laboratory should develop its own set of KPIs because it depends on how things are done in their own structure, in their own procedures. So it has to be founded on laboratory organization and processes. As we know, although many things we do in the same way, labs are very unique and they have their own ways of doing things. And each own way can work very well at their hands for their experience. So as per the Vienna consensus, here are some examples of IVF lab KPIs and actually the 3 types of indicators that I mentioned to you. So first, the reference indicators. These are usually not under lab control, right? It relates to the characteristics of the incoming raw material that you are receiving at your lab. And you can see the examples here, proportion of oocytes recovered, for instance. And then we have performance indicators. Performance indicators is the data should be documented and stored, but you're not routinely tracking, reporting in a control chart. And here are some of the examples below, for example, sperm motility post-preparation. And then key performance indicators, these are the ones that you will be analyzing on a monthly basis in your quality control chart. And you are going to be using this as your core indicators for the ART laboratory. And as an example here, you can see blastocyst development, cleavage rate, and ICSI normal fertilization rate. Despite a limited number of publications on performance indicators for IVF, you do have some consensus publications that are very great reads for you to consider. And here are 3 that I would like to suggest to you. You will have the chance to get the references at the end of my presentation. So those are all the articles that we have used today to support this presentation content. With that, I would like to conclude this presentation with 3 take-home messages. First one, KPIs and benchmarking are essential components of an IVF lab quality management system. Also, each laboratory is encouraged to develop its own set of KPIs because it depends on their own lab organization and processes, but develop a systematic, transparent, and consistent approach to the data collection and analysis. So you base that on a strong data collection and maintenance as well. And the last one would be there are published competency levels and benchmarks available for IVF labs. So use those. Go to those publications, read them, and decide what would you like to consider for your laboratory. These are the references used for this presentation. And thank you for your time and your attention today.
And you can connect with our program. We are posting daily our research activities, large number of research articles. You have free access to all these publications that we are offering. We are also sharing our latest research presented at ASRM, which is American Society for Reproductive Medicine, European Society for Human Reproduction, American Urological Association. Um, Also, you can learn about our research opportunities and ART training, which are online ART training and opportunities to collaborate. You just have to find me on LinkedIn, Ashok Agarwal Cleveland Clinic, and you can send a request to join.